actually seeing is the systematic implementation of the fall of the republic and the rise of the corporation of the United States. Every major event is a step in the ladder to achieve that end. COVID is just another rung in the ladder, which is why there's a deliberate mixing of all the wordplay, right? I mean, we should stop calling it, quarantine. That's a term designated for people that are verified sick. This is a house arrest mandated by the state. You should stop calling it, social distancing. There's nothing social about forced isolation. We should stop saying safer at home when millions of Americans don't have basic necessities adequate to fit their needs. It assumes that everybody's home is equally as safe as the people that are making the statements. We should stop saying, this is for the greater good, right? When you close the economy, killing millions of businesses that families have worked generations to establish, that's anything but good. We should stop saying this is the new normal. That's just blatant mind control drivel. There's nothing normal about forced isolation, treating your neighbor like they have the plague, breathing your own bodily waste, wearing masks, living in constant fear of contamination. That's normal. I mean, after all, if the virus is so deadly, why hasn't it wiped out the homeless who don't social distance, wash themselves regularly, let alone, live in or have access to a sterile environment? Last year, 1.5 million people died of tuberculosis. Why were you not wearing a mask during the tuberculosis pandemic? You were endangering, public health and safety along with billions of other people around the globe. So why didn't you wear a mask? I'll tell you why. Because the mainstream media didn't tell you to wear a mask. Right? And so because though 1.5 million people died from tuberculosis, there was no tuberculosis pandemic any more than there's a coronavirus pandemic. What you're really participating in is a beta test for AI systems and facial recognition. See, these cameras work best when people are, distanced apart. Now they're actually testing through machine learning how to recognize, a face that's partially covered. It's also a way to easily determine who's compliant and who's not. Who does the propaganda work on and who it doesn't? Now get this, there's some ironies that are here, right? A society that kills millions of babies a year for convenience has shut itself down to prevent adults from dying. People that on the one hand slaughter babies in the womb by the millions are now preaching to the masses about the sanctity of human life. It's double speak, double talk. It's the two doctrine policy. One for the initiated, one for the uninitiated. One for the inner circle, another for the masses. It's like saying, if I violate the stay-at-home order, I can be arrested, but you're letting convicted criminals out of prison so they don't get coronavirus. Thesis, antithesis, synthesis. If there's a real pandemic, does it require, faulty virus models, rigged test results, 81% false positives, inaccurate news reporting, staged hospital overruns, manipulated death certificates? Nope. When the government shuts down, millions of small businesses, but doesn't lay off any government employees, it's not about the health. When the state bans dentists from practicing but deems it necessary for abortion clinics to stay open, it's not about your health. When the state prevents you from buying seeds for your garden but allows you to purchase lottery tickets, it's not about your health. An institution that has the ability to destroy all of Earth through alleged nuclear warfare should not regulate personal self-defense. An institution that's caught trafficking drugs shouldn't be able to regulate plants. An institution that's racked up $23 trillion prior to coronavirus in debt shouldn't be allowed to manage the retirement fund. An institution that was caught spreading STDs should not be allowed to run healthcare. If people are really concerned about public health and safety, in general, but they don't care if people eat garbage, drink poison, smoke cancer, and take prescription drugs, but think that toilet paper, hand sanitizer, and masks are going to protect them from the boogeyman coronavirus. This is a special kind of stupid that I can't address here. You should ask yourself a couple basic questions. When did you consent from, you creating a government to serve you to you serving the government ruling over you? If you want to know, who's in charge, just think about who you can and can't criticize.
Reaction to an interview I did last week with Dr. Mike Yeadon. He's the former chief scientific advisor with Pfizer, the major pharmaceutical company. And he, along with many others, including Carl Hennigan, the professor of evidence-based medicine at Oxford University, and I really defy anyone to question those credentials, have been questioning whether or not we are, horribly overreacting to a virus that, like all viruses, we are going to have to learn to live with. And big question marks over whether or not the policies with many Western governments, including the UK's, have been following over the recent months are actually having any effect at all. Well, let's talk about all of this once again with Dr. Mike Yeadon, back, I think, quite literally by popular demand. Good morning to you.
Good morning, Julia. Nice to be back.
Lovely to talk to you. We've had almost 100,000 views on YouTube of your video. Lots of reaction on Twitter. A lot of people just saying, great to actually hear someone sort of expand this. Now, let's just talk about some really basic stuff here. We saw yesterday 3,991 positive cases for coronavirus. It's up 50% in a week. You can understand why huge numbers of people are incredibly worried that we're seeing that uptick in cases. Should we be worried?
Well, thanks for having me back, Julia. So, of course, I definitely don't want to dismiss the possibility that these numbers are real and that people will get ill and potentially go to hospital or even die. But the evidence to date, I think, suggests that all or a substantial part of these positives could be due to what's called false positive tests. Now, government knows that the PCR test is very sensitive, and all tests have a propensity to throw up a particular false positive rate. What's really frustrating, Julie, and your listeners should know this, the government doesn't know what the false positive rate is, or if it does, it's not declaring it and continuing with the assumption that it's zero, and it's definitely not zero. And Carl Hennigan did a calculation, and he showed that if the false positive rate is as little as 0.1%, then more than half the positive tests are in fact false or fake. And I think the false positive rate is probably much higher, possibly 1%. And if that's true, most or all of the positives are actually false, and they're not infected, infectious or ill.
And the key thing there is, of course, I mean, again, for those of us who are not medically trained or scientifically trained, or indeed a great mathematics either, it's because the actual percentage of people who are being tested positive is a tiny percentage. So if you have a false positive rate at that level, you actually are accounting for effectively all of the positive test results. And this comes down to how they're testing and how they carry out these cycles to sort of try and get particles of a virus. And as far as I can understand it, it seems to be along the lines of the fact that we are finding traces of the old virus, basically dead virus that's been caught 6 months ago, that could not possibly make the person ill currently and could not possibly be infectious to other people, in which case we're finding 3,991 cases of people, largely of people who may or may not have had the virus in the past or don't have the virus at all, in which case not much to worry about.
Yes, I do think just a couple of things. So you're absolutely right. We know that, because it's been shown, that people who've recovered from the virus and they're clinically well, and you can no longer culture virus from a sample from their mouth or airways, still can be positive in the PCR test. And that's because, as you say, the test is not a test for virus. It's not a test for living virus. The test looks for a particular piece of the genetic code. And if it finds a small piece of a dead virus that's still stuck in your mucus and is being shed from cells, you could still be positive on a swab test for a long time. So that's what I think is a significant contribution. And the other one is just intrinsically that tests occasionally, statistically, throw up false positives. And as you say, a very good point, Julia, that the ONS survey still says that the prevalence of the virus is very low, which is good, less than 0.1%. So if we find 2% positives and yet no one's ill, I'm worried that specifically Matt Hancock's Pillar 2 test is flawed.
That's community testing. That's people who are going to school, going to work and getting tested. Yeah.
Yes. And I think, did you see on the TV the other day, they showed a little clip of people beavering away on a line of white tables, looked like big picnic tables, and they were in something that, for all the world, looked like a marquee tent. And there were some, people casting around, wearing gloves and so on. I think if they're really doing the tests or processing the samples there, you've got to be kidding. Imagine this was a test in a forensic case in law, because this is the same kind of thing. They use PCR to try and prove you are or are not the guilty party. But if you were doing your forensic work in a tent like that, the lawyer would just throw it out and say, don't believe it.
Right, that's a fair point. Now, what about the argument that, okay, a load of these may be false positives, a load of these people are not a risk to themselves or others, but we are following behind countries like Spain and France. They've also seen a big uptick in the number of cases, although they're not testing at the same level. And they are now, and we're 3 weeks behind them, they are now seeing an uptick in people getting into hospital and in terms of deaths. And we are now seeing that uptick in hospitalizations and in deaths. Is that not evidence that we should be worried that we are heading into the so-called second wave?
Yeah, no, so it's a fair question. I will tell you, I'm very humble and very worried that if I'm wrong, I would hate to sort of mislead people. But I did check this morning, and the number of COVID deaths, at least in NHS England, is continuing to stay low and falling. So I can't tell you what the ITU, the intensive care state is, or number of admissions, but it has fallen constantly for 6 months. So for it now to turn and increase, we would have to have some big change in transmission. So let me just comment on something. I read a paper by somebody that's made me rethink the data. The story going around at the moment that very many more young people are testing positive in this PTR test. And people have said, oh, well, it must be the young people are, interacting with each other there as they do and not obtaining, looking at social distancing. Well, that's possible, but I always felt that was implausible because young people felt rightly less at risk from this virus from the get-go. And as my children in their 20s have said, what, Dad, young people have not been spending as much time social distancing. So what I'm saying is they would have caught it. They would have been the first people to have caught it and survived. So the idea that now, 6 months later, the young people are selectively getting it, I just think that's for the birds. And I read a paper yesterday by a pathologist who's looked at this data and come up with a different and dramatic conclusion. She says, this is Claire Craig in Spectator, she says, if the positive tests are false, they will be distributed evenly across the population, whether you're young or old. And you know what? That's what we're finding. Now, 19% of the positive tests are in the under 20s, whereas during the pandemic, only 2% of the cases were in young people. So she's saying it's now spread evenly. So it's either that the virus is even or more likely that it's just it's a feature of testing lots of people and it's just false positives.
So the bizarre thing, we're being told the answer to coming out of this this predicament we're in and avoiding a second lockdown across the country or curfews and the like, saving Christmas, the Prime Minister has said in an interview with The Sun. The answer is more testing. But if we've got testing that is showing up so many false positives and people who are not infectious, who are not at risk, the risk, of course, is that more testing creates more cases, creates more worry, is more likely to lead us to have a curfew and lockdown, in which case,
Yes.
Well, what is the answer if it's not testing then?
Okay, so I've got the answer. One comment, Sweden is not doing mass testing, and so far their society is not riven with ill people going to hospital and dying. And the reason I mention it is that they have had the same percentage of their population succumb and die, 0.06%, as we have had in UK, and over the same timescale. So I think it is at least worth looking at what they're doing. But I'm going to repeat to Matt Hancock the same challenge I made last week, which is that you're using a test with an undeclared false positive rate, which I think is dreadful because it's having a big impact on people. If you don't know what it is, shame on you. And if you do know what it is, you must disclose it. And finally, some advisors have issued to you guidance to retest the positives before declaring them. Are you doing that? We'd all be more satisfied. If they're genuinely infected and really got the virus, most of the time they'll test positive again. I think a lot of them, being false positives, will not test positive if you immediately repeat them. And that's good practice. That's the advice to the minister. Why isn't he doing that?
That's certainly a challenge we'll be putting to the Health Secretary next time we speak to him. You brought up Sweden, and this has been a very big issue. Sweden famously being the country that didn't go into a formal lockdown. They went into a semblance of lockdown in terms of it was voluntary. It was advice about social distancing, but pubs and bars stayed open, schools stayed open for all children up to the age of 16. They don't wear masks. People just largely getting on with normal life and being fairly sensible. All the evidence then is pointing, as you say, given the similar death rates around the Europe, and again, where they do differ, there are large factors that can explain that, which are quite separate from what governments have done or not done. Do you think that actually our best hopes of getting through this will actually be following what Sweden has done rather than, say, a second lockdown? And what are your fears if we did go into some version of a second lockdown, leaving aside the economic effects, but the health effects of a second lockdown in terms of coronavirus?
Yes, I think if we have a second lockdown, I think we're going to amplify the negative effects. Forget the economy. It's very important. Forget the economy. If we have another lockdown, I think we're going to amplify the non-COVID deaths that I think have happened already, and we're not much talking about them. It's as if there's no other health condition in the country worth paying attention to. And the consequence of locking down and restricting access to the health service in case there's a second wave, because that's an official policy that they've not bothered to tell you about, I think that's going to have, and has already had, the consequence of killing or allowing to die savable people from non-COVID illness. And I think so. Lockdown, I wouldn't do it. Let me just mention briefly, it is now established our lockdown, our national lockdown, occurred too late to make any difference to the initial spread of the virus. Even, I think, Professor Chris Whitty accepts this. So think about it. We didn't introduce masks until quite recently, and our lockdown was too late to prevent the initial spread. I assert that actually what has happened in UK is very similar to Sweden. We made efforts that were distinct and different, but I don't think they made any difference because lockdown was too late and masks very much later. So it wouldn't be surprising if we've had the same lethality, the same population percentage who have died, unfortunately, then why aren't we in the same place? And it's worth noting, I had a quick look around the data in Africa, and if mass population immunity is not keeping the numbers of illnesses and deaths, for example, in Malawi, right on the floor. The imperial projection was for tens of thousands to die. I think they've had 250. So, and a virologist from that country has said, I can think of no other explanation than mass population immunity to explain the difference between the model and what's happening.
And that's the question of whether or not we actually do now have enough population immunity to stop an exponential spread. We will, as we head into autumn and winter, we will see more people dying, but that is the nature of these respiratory diseases.
I see parents walk in, I see diabetics sit in my office knowing that this is a death sentence and they can't breathe. And I hug them and I tell them it's going to be okay, you're going to live. And we treat them and they live. None has died. So if some fake science, some person sponsored by all these fake pharma companies comes out and say, oh, we've done studies and they found out that it doesn't work, I can tell you categorically it's fake science. I want to know who is sponsoring that study. I want to know who is behind it. Because there is no way I can treat 350 patients and counting, and nobody is dead, and they all did better, and then you're going to tell me that you treated 20 people, 40 people, and it didn't work. I'm a true testimony. So I came here to Washington, D.C. to tell America, nobody needs to get sick. This virus has a cure. It is called hydroxychloroquine, zinc, and Zithromax.
Is there a very clear and provable paper trail that proves that the U.S. government did in fact work to help manipulate and create this latest coronavirus, and that this virus is actually the product not of nature, but of man-made manipulation? The answer to that question is yes.
Many of the things that have been postulated to be novel about the coronavirus that we're currently talking about are things that were very clearly documented in experimentation in vitro in labs going back as far as 2013 in patent applications and in grant filings.
One-on-one with Dr. David Martin. You've probably seen him in Plandemic 2, and today we're talking in great detail about something I've been reporting about for 2 months now. The very clear paper trail that connects US labs, DARPA, and the creation of a manipulated coronavirus over the past couple of decades that has ultimately led us to where we are today. Now, fact checkers will tell you all of this is conspiracy theories, but here's the problem. It's not based in theory at all. It's based in factual source documentation, black and white paper trail that's very clear. Well, Dr. David Martin, thanks so much for being with me today, and I want to begin by talking about this issue that I have actually been researching now for over 2 months, and that is the paper trail that proves that the U.S. did in fact work to create a manipulated coronavirus, outsourced to labs in China, 6 different virology labs, and paid for development there, including the lab in Wuhan. The documentation that I have found so far, I have reported on, but you are now providing new information on this story. What can you tell us?
This is a great conversation, and one that really deserves an entire expose, because the fact of the matter is that NIH made the determination to stop gain-of-function research. And as we show in the letter that was sent to funded organizations, the one we made reference to is the one that was sent to the University of North Carolina at Chapel Hill, specifically directed at the coronavirus architect of chimeric mutations of coronavirus, Dr. Ralph Baric. And as we showed in the film, what the letter said was that the NIH had concluded that the work that was being done potentially was problematic. At the bottom of the letter, it basically said, since your grant is already funded and ongoing, we're not telling you to stop. Co-funded grants, funded both by the Chinese government and by the United States Department of Health and Human Services through NIAID, Anthony Fauci's organization, and through the National Institutes of Health generally. Now, here's the tiny problem. We, as a nation, in 2012, going into 2013, decided that the work that was being done crossed an ethical and potentially legal line, and we as a nation stated we weren't going to advance it. Every one of the letters that was sent to every funded researcher, both domestic and foreign, all came out with the same statement that said, you're not supposed to do the research, but ... This is a recognition that the National Institutes of Health and the National Institute for Allergies and Infectious Disease, Anthony Fauci's own organization, specifically took the will of the people and suborned it without question in writing in these letters that essentially said, keep funding. And that's where we have a tiny bigger problem, because that tiny bigger problem is that many of the grants that were going to the active chimeric coronavirus researchers, many of those grants were ongoing and evergreening grants. There's a thing called an R01, a center grant, which is one of the instruments through which the National Institutes of Health and National Science Foundation and others get funding to researchers. In many instances, these evergreening grants were ones that effectively, based on the NIH's own written statement, said, while we're going to tell you that we think your research is problematic and potentially unethical or illegal, we're going to go ahead and look the other way and allow you to do it. And that included funding graduate students who also themselves had joint appointments both in the U.S. and China.
Yes, and there is no question about that, but there is another question on top of that, which goes back, it's almost the precursor question. The why. Why was this deemed to be immoral? Why was this deemed to be possibly illegal? And from what I have seen of documents at that time, there was an honest debate going on within the scientific community of whether or not the essentially mutation or the alteration of coronaviruses to make them attach more easily to human cells was the right or wrong thing to do. Have you found that as well? Is that what that debate was over?
Yes. In 2005, Ralph Baric made a presentation to DARPA. This, by the way, is not only a public record, but it's on his professional CV. In that presentation and in subsequent work, there was an awareness that coronavirus represented a very interesting mutable pathogen, which would allow you to potentially build, both for offensive and defensive purposes, means by which a population could be either inoculated or infected. When DARPA gets involved, obviously the funding trail becomes much more problematic. But we do know that in 2005, the United States Army and DARPA began a process through which they started manipulating the coronavirus, specifically by taking two different strains of coronavirus and amplifying pathogenicity of the virus. Now, you don't have to be a scholar, you don't have to be a geneticist, you don't have to be a medical ethicist to realize that when you begin the process of not only in your own labs, but with international graduate students present from all over the world, when you have the ability to start showing the world how to manipulate a pathogen for potentially offensive and defensive military applications, the risks that are associated with that start going through the roof. So we have a period from 2005, when we know the DARPA initiative got underway, to 2013, when Dr. Baric submitted in grant applications information about a super pathogen, which was his chimerically altered coronavirus. We know that during that period of time, and as you know, it's overlapping the period of time that MERS came out, which was the Middle Eastern respiratory syndrome, which most people seem to forget because it didn't really land with us here. But during that period of time, we know that a highly virulent form of the pathogen was lab created. And we know that mutation was funded by and was supported specifically both by DARPA and by the National Institutes of Health.
And it's to that point, we also know something else, which is that go back even before that. Because you're right, 2005, there was a great deal of discussion about this. But go back to 2002, 2003, and the original coronavirus, SARS, right? One of the, for lack of a better term, complaints about SARS in the medical community, and certainly from people like Ralph Baric, was that it did not attach well to human cells. And therefore, remember, a lot of folks do not remember that SARS itself self-eradicated. There was no vaccine created to get rid of SARS. It self-eradicated in a very short amount of time. And so the complaint was that this coronavirus did not have the ability to attach well to human cells, but if it were manipulated, if the spike proteins were manipulated, it could be altered to attach better to humans and therefore could be more lethal.
Not to take you further back in the time machine, but we need to go back a little further. Remember that for the decade of the 90s, going back to the late 80s and all through the early and mid 90s, Dr. Ralph Baric's work on coronavirus had to do with rabbit cardiomyopathy. People are not familiar with that because we're not familiar with the fact that coronavirus, for the majority of the human and the mammalian evolution, has actually been more concerned of the vascular system than it has been with respect to its effect in the pulmonary system and the breathing apparatus, right? So it was in 1999, and this is important, it's 3 years before SARS, the outbreak. That 3-year period was when Dr. Ralph Baric began the mutations of coronavirus, which included focusing on the receptor binding domains, the spike proteins, and specifically the ACE2 receptor, which is what lands the virus so neatly into both the lungs and potentially into the kidneys, where we have a high prevalence of the ACE receptor in the human system. So ironically, we don't have the evidence, and the evidence would be probably impossible to source, of the degree to which the overlap that took place between the first alterations of coronavirus in the population occurred starting in funded research in 1999, but we know that from 1999 to 2002, so before SARS 1.0, we know that humans were messing with SARS specifically around those pathogenetic links. And one of the questions that I merely posit, because it is in fact just a question.
Right.
You know, we know that the researchers who were looking at this were in and out of their own labs and in and out of caves and working with bats and all sorts of other things. That's very well documented. We don't have any way of establishing whether some of the things that humans did to alter coronavirus actually went not from bats to humans, but potentially from humans to bats back to humans. I mean, the possibility, unfortunately, in the official narrative is that everything goes from an animal to a human. At no point are we willing to hold as a possibility that some of the mutations that we see in the coronavirus may in fact have gone from laboratories to nature, then back to humans. So these are things that we don't have information about, but what we do know is we can go back to 1999, 2000, and 2001, and we can look specifically at the targets that Ralph Baric and others were focused on with respect to the respiratory side of this pathogen, and then ask ourselves, how was it that we went through all of human history, had the evolution of coronavirus, and it was largely a cardiovascular problem, and suddenly we start messing with it in 1999, and 3 years later we have the first outbreak. We start doing more chimeric alterations in 2012 to 2015, and lo and behold, we start having abnormal and untested flu-like pathologies in 2017-18, 2018 and 19, and then we decide to start testing for coronavirus in 2019 going into 2020. The fact is, we don't have pathogenic data to show us whether or not SARS in a different form was around in the 2017-2018 flu season, which killed tons of people here in the U.S. and around the world. We don't know.
We're going to show you. Now, this is the first time this is the official U.S. statistical profile. It has been the U.S. statistical profile for months, because a lot of this data we're about to show you, we have shown you on this show for months. But the problem is it wasn't stratified for you. So people like me or Daniel Horowitz or Jordan Schachtel and this other, ragtag group of what's left of the colonial fleet after the Cylons destroyed the rest, all right, trying to make our way to this place called Earth. We have had to piece this independently together, meaning the CDC puts this data out there whole cloth. But it's not given any stratified meaning. So you guys have always asked me, well, Steve, what's your source on this? And I can't send you to a link because it's my own proprietary work with the CDC's actual data. For you to see it yourself would mean you'd have to recreate my work. You know what I'm trying to say?
Right.
Like I'm taking their data and then putting it in a form that makes sense to you. But I can't supply you a link because it's often our own work as independent researchers.
Involved in that, if you do not believe it or you just want to verify it, then you have to go through that process yourself, and which you are entitled to, and you can poke holes into it, and then we can make each other better.
Right.
But just whole cloth denying it because there's no link.
But that's going to take you hours of work.
Yeah.
I know, because that's what it takes me. Okay? It's going to take you hours, and I do this professionally. It takes me hours of work. I couldn't imagine doing this like as an amateur sleuth and not even knowing where to begin. All right? So for the very first time ever, we can now show you the official stratified, and what's the date today? August 11th. August 11th, March 11th is when the world really ended in this country with the mass shutdowns and everything else. That's when Anthony Fauci went and testified before Congress that, hey, this is 10 times worse than the flu, right? That was the day. I think the next day is when the NCAA tournament canceled and everything else. So it's August 11th, and for the first time, we can show you the real official stratified mortality data. We can even give you the link to the table there at the bottom of the video, because 800 of you are going to email me, Steve, what's the link? What's the link so I can share it? It's right there, at the bottom of the video. You can finally now, without having to do all the independent research and piecing it all together to make sense of what it means on your own. That's what I've had to do for the last few months, and people like me. Now, finally, the government of these United States is going to do it for us. All right? Here are the real COVID-19 facts the media doesn't want you to know. Right from our CDC. This is through August 1st. All right? All of their data through August the 1st. 85 and older are just 3.2% of the U.S. population, but they make up 1/3 of all COVID-19 deaths. 75 and older are just 7% of the U.S. population, but they make up 59% of all U.S. COVID-19 deaths. 54 and younger are 70%, I'm sorry. 70% of all U.S. citizens are 54 and younger. And yet 54 and younger are just 8% of all COVID-19 deaths. Again, this is through August the 1st. Deaths don't even register a percentage on their metric until we reach age 15 to 24. And even then, it's just 0.2%, which means kids college through undergrad are in no significant danger of dying of COVID. Your college student right now, if they get COVID, they're an undergrad. 98% percentage that they will recover if they get it?
If they get it.
If they get it. That's the percentage of recovery if you have a college adult, according to our CDC through August 1st. And if they're younger than that, the odds go demonstrably higher. In fact, if you look at the table, I believe it only records, is it 45 deaths total or something like that for kids K through 12 in the entire country of COVID-19. That's why they've been outside, at home, all over the country all this year. Now, here is the key thing to keep in mind, though, okay? There's two things to keep in mind. Number one, the median age of COVID death right now in America is 78. If people keep sending me notes, Steve, I'm trying to do the research you're doing, and I'm looking at the excess deaths in CDC, and I'm seeing it's not that much higher than it is in 2017 or 2016. I must be reading this wrong because I'm watching the news, and it's all this bad news, and yet when I look at the total excess deaths, which, by the way, if you're researching and you're starting there, you're smart. That's the right place to begin to get a baseline. You're right to do that. You're smarter than the average bear. Props to you. But you're going to note that there's not a huge difference in these numbers. And so a lot of you have been emailing me, Steve, it doesn't make any sense. I mean, I know what I'm seeing on the news. I know people that have gotten this. I know people that have died, but the total excess deaths in this country, what did we say about a month ago? Texas was at only 2% higher excess deaths than it was at this time last year. Do you want to know why that is? Go back, put that back on the screen, Aaron, full screen. This number right here is why. The median age of COVID death in America right now is right around 78. It's like 77 point something. So it's right around 78. You know why that matters? Do you know what the average lifespan is in the United States right now? What average life expectancy in the U.S. is? 78. That's why you're not seeing massive amounts of more of excess death. Because even Neil Ferguson, when he screwed the world with his crackpot model at Imperial College that turned out to be false, even in that model, you know what he said? That he estimated about 63% of all COVID deaths were going to be people that died within a year. Anyway, premorbidities, comorbidities, respiratory failure, cardiac failure, morbid obesity, right? Remember when he said that? Guess what? That turned out to be the only thing he was right about. The median age of COVID death in America is 78. That is the actual life expectancy in America right now. That is why you're not seeing massive amounts more of total excess death. Because COVID-19 is killing people, sadly. But it is, by and large, killing people that were probably going to be killed this year anyway. And that's why the total excess deaths have not skyrocketed. I can't stress that point enough when we start talking about getting back to being some form of normal as a country. And then this next point is another one I can't stretch enough. All of this COVID-19 mortality stratified data from CDC, keep in mind how they code it. It's all coded as death with COVID, not from COVID. We don't actually officially even know. Now, we can do all the research and give you a pretty good educated estimation. But we don't officially know what the numbers are of people that have died from COVID itself, meaning they weren't going to die until they contracted COVID. And that is the cause of their death. They didn't die in a car accident and test positive. They didn't jump off a building and test positive. They didn't already have diabetes and tested positive. They already didn't have stage 4 cancer and tested positive. They already didn't have respiratory failure and tested positive. Meaning they were otherwise healthy, no comorbidity had presented itself until they contracted COVID and then their body failed. We don't have those numbers. It's August 11th.
An NBC medical contributor, and I'm talking about like some just talking head. This guy's an actual doctor. He says he has COVID-19. He went on multiple NBC shows, and both he and the host of these NBC shows all discussed how he had contracted COVID through his eyes by sitting on a plane. Now, this crack team at NBC News apparently knew that he had tested negative for COVID. And I'm not talking just once. He had apparently tested negative 4 times. And then they continued to interview him regularly as if he really had COVID. This guy, Dr. Joseph Fair, has now admitted that he did test negative for COVID, but he also tested negative for the antibodies, meaning he's never had it. He tweeted this: "My undiagnosed suspected COVID illness from nearly 2 months ago remains an undiagnosed mystery as a recent antibody test was negative. I had a myriad of COVID symptoms, was hospitalized in a COVID ward, and treated for COVID-related morbidities, despite testing negative by nasal swab." Now, did he disclose this to anyone during these interviews? I don't know. I don't have any idea. But I do know it's clear that no one at NBC News really questioned this diagnosis, only sharing the symptoms. Here's what the doctor tweeted. "I was, quote, severely ill for 2 weeks, 4 days of it in critical condition, resulting in pneumonia, diffuse lung injury, and 18 pounds of weight loss. My path forward is a second AB test, followed up with a pulmonologist and a tropical medicine specialist in an effort to diagnose what made me so ill. While I can appreciate that he's been ill, his story is a lot less meaningful given the fact that he isn't actually a legitimate victim of the pandemic as he claimed to be. And NBC hasn't clarified any of their mistake yet. And why not? That's why I want to bring in former CNN anchor and brand journalist Heidi Collins. Heidi, welcome back to the show.
Thank you, Sean. Thanks, Lindsay.
All right, so there's 2 things that I think are fascinating about this. Number one, a doctor, a medical doctor, lied. He knew he didn't have it. I don't care how many symptoms you have. There's a test, and if you don't have it, you don't have it. And so for him to go on claiming to be a victim of the pandemic, of coronavirus, is a falsehood. Second, all of these hosts, Chuck Todd, Craig Melvin, Hoda Kotb, all perpetuated the myth and talked about this. And they undermined things like flying on an airplane because they assumed that he got it from there because they didn't do their job. And so the thing that I think is fascinating, I want you to first comment on, is while he's tweeted a couple times, as I just noticed, NBC News and Chuck Todd and all those other people have said nothing. The story's still up. We contacted NBC News. We reached out to Chuck Todd. Nothing. What obligation do they have to be honest with their viewers? I know they're all big into the truth, so what obligation do they have, Heidi?
Oh, Lord. I mean, the hypocrisy is just absolutely undeniable. Never let facts get in the way of a good story, right? I mean, isn't that what journalism is all about? I mean, why on earth should Chuck Todd have to come forward? And by the way, as you well know, both of you, we have talked about his tactics, if you will, journalistically or otherwise on this show before. There never seems to be anywhere near the same amount of importance placed on an apology or a correction as there is when there is something so egregiously and flat out false as something like this. I don't know why the whole network isn't coming out. I don't know why Dr. Fair isn't coming out and saying, hey, you know what? I thought I had the coronavirus. I apparently really wanted to have the coronavirus, but I didn't. And I'm sorry if I made anyone more afraid or more confused with my medical journalism that I am offering to the public.
You know, Heidi, as Sean
Heidi,
always says.
go
ahead, Sean.
Go ahead. No, I was just going to say, I get it. But listen, the funny thing is, I didn't feel well once. I went into the hospital. They said, okay, you've got some symptoms. We did a test. They said, you don't have it. That's how medicine works. And yet this guy, a doctor in NBC News, continued to perpetuate a lie because it fit their narrative. They wanted to be able to talk about all of this lack of testing and all this. They knew the truth, and yet they lied.
No doubt about it. And you nailed it. And you know, the same thing happened in our house. My husband was not feeling well, went and got a COVID test. Luckily, we found out very quickly it was negative. I don't know why you would ever want to perpetuate a situation, as we've said earlier, as scary and confusing as this, if you didn't have a motive. And if you weren't perhaps being told by certain people at a network, hey, you know what? This is a really good thing we've got going. We're able to follow this story, sort of like a documentary style thing. This is really good TV. Again, never mind the fact that it ain't really what's going on. So I don't know. I hope to hear more from the doctor, from the network. I wonder if he'll continue to work there. Will he still be deemed as credible? I wouldn't believe him.
Yeah, those are all really good questions. And I think this is a point too, Heidi. They have still reports up on their website. So it's not only the host and anchors who have not revised statements, but there's reports on May 14th of Dr. Fair's entire journey. Do you think that those should be revised? Should they put an update on those and say, hey, this is actually incorrect, or even just take it down?
Absolutely. And we know how easy that is to do, right, Lindsay? I mean, especially in this digital age of news where things are changing within seconds of breaking news or otherwise. Absolutely. They should be taken down. And if at least there should be a line or two right at the top that says, by the way, this is completely false, or don't read this, or something. I mean, it's very simple. And maybe they're spending too much time on covering like really good news, like the stock market, perhaps. Today, you know, we've got incredible numbers out there. Nobody's talking about that. It's not on anybody's website. CNN, MSNBC, NBC. It's nowhere on there. And meanwhile, we've got some of the hugest numbers that we've seen in decades. So I don't know.
Hey, Heidi, let me throw this at you. Tell me if I'm going a bridge too far here. But back a little while ago, I think it was a year plus now, NBC News had their chief medical person, Dr. Nancy Schneiderman. They fired her for sort of misbehaving when she may or may not have had I think she had a disease or something. And then this guy lies about a medical diagnosis, and yet they don't even make a comment about it. Do you think there's a double standard because Dr. Nancy Schneiderman was a female doctor and this guy's a male doctor? Do you think gender has anything to do with this?
You know, I think I don't know that I would need to even go that far. I would go so far as to say it was an election year, right? It wasn't an election year cycle, and we weren't talking an awful lot about presidents that are up for re-election. So I think maybe that might have a little bit more to do with it, given you know, the popularity at that particular network with our sitting President Trump.
Dr. Schneiderman,
she was some of this stuff just blows my mind. How, you know, how they get away with it.
No doubt, no doubt. And people should be really taking that into consideration when they choose what network or what television news they are tuning into. And certainly if they have the time to watch all the news all the time, all day, then they might be able to get some sort of triangulation of what, you know, truth really is. But like most people, unfortunately, they're just watching one news source or reading one news source, and then they'll have to try to figure out, wow, is that fact or fiction? And these are the exact examples where networks, you know, get into trouble because credibility is king. I mean, that's what journalism and news is all about.
Yeah, I should just save everyone some time and just stay on Newsmax TV, go to newsmax.com. I mean, it's just so much easier. Anyway, Heidi, thanks for your time today. I appreciate it, as always.
We all want to do our part, right? No. No. You conservatives don't. Anybody who's living in a red state, you just want to kill grandma. Well, let me tell you something. Last week, the UK health officials said that mask mandates and social distancing could go on for years. Isn't that exciting? For years. Now, could I ask you a question? How is that happening at all? How is that possible at all? I mean, we've got 2 vaccines. They're about to hit the market. They're 95% effective. Wait. I thought we had to do these things until we got a vaccine. Okay, now we have a vaccine. Well, we have to wait until it's injected in people's arms. Now it's going to be injected in people's arms. 95% effective. Why do we still have to do all these things? Why? Now, if you are caught defying this, you will be shut down, you'll be silenced, and as we're seeing lately, fired. A doctor in Oregon attended a Trump rally a month ago. He had the audacity to have a different opinion. He told attendees that they could take off their masks, and none of his staff wore masks for COVID in his office. Oh my gosh! He's a danger to society. We have killed him, haven't we? We didn't just fire him. We didn't just take away his license to practice medicine. I hope we've killed him. Well, he was already on the Oregon Medical Board's radar. Back in July, he actually had the gall to tell a patient that wearing a mask doesn't prevent the spread of the virus. He advocated for something crazy called herd immunity. What a quack! We should kill him. Well, the masters of the universe, a.k.a. the scientists that will toe the party line, have been telling us lately on their televised hits on MSNBC and the like, we're supposed to lock ourselves in our homes. We're supposed to close the family business. We're supposed to put a mask on even in our Zoom calls. Sit down and take it. Now, here we have a doctor, a man of science, saying, that's stupid. Shouldn't his opinion be taken seriously? Of course not. Of course not. Not according to the State of Oregon Medical Board, because they launched a little investigation. And apparently that little Trump rally was the last straw, and they officially suspended his medical license for, quote, gross negligence, claiming he, quote, actively promotes transmission of the virus within the extended community. Yep, that's what he was doing. That's what he was doing. He wasn't questioning masks. He was promoting the transmission of the virus within the extended community. Oh, so you see, if everybody would just wear a mask, we'd be able to crush the virus and end the pandemic. Why do you not care about your fellow Americans? Why? Did you not listen to the public health experts? Because the problem's not them. The problem is you. Because you won't wear a mask. Have you seen the numbers in the hospitals? They're going up. This pandemic is getting worse, and because you wanted Thanksgiving, and now I suppose you want Christmas as well. Well, you go ahead and kill more people, why don't you? Well, unfortunately, now we're going to have to fire all of the people at Carnegie Mellon University, but they have developed a very informative, consistently updated mask compliance tracker, just to find out who's wearing a mask and who's not. Oh, yeah, Santa is coming to town, and he knows who's wearing a mask and who's not. Well, according to Carnegie Mellon University, the overwhelming majority of Americans across the nation are wearing masks. In fact, in virtually every major population center in the United States, especially in areas where COVID-19 cases are rising, mask compliance levels are off the charts, with most major metro areas registering well over 90% compliance. So wait a minute. The lockdowns failed, and we were told masking up. If you could just mask up, remember? Mask up. If we could just mask up over 80%, we'll do more to reduce COVID-19 spread than a strict lockdown. Really? So universal masking at 80%. If 80% of us just adopt that, that flattens the curve significantly more than maintaining a strict lockdown. Scientists told us, quote, we'll not only be able to flatten the curve, we'll be able to significantly reduce the spread of this virus and return to life as normal sooner rather than later. Oh. Okay, well, are we doing it at 80%? San Francisco 97% mask compliance. Hey, how's COVID doing in San Francisco? It must be flattening. New York City, 97% compliance. Hey, how's New York doing? It's flattening, right? Cuomo's got it under control. D.C., 97% of the people there are wearing masks all the time. Dallas-Fort Worth, yeah, it's just like those people in Texas. They don't care about people. Yeah, 94% compliant. Philly, 96. Chicago, 95. Miami, 96. Seattle, 96. Now, these are the places that have had the harshest lockdowns. I mean, unless you're in the movie business and in California, then you can pretty much do whatever you want. But, I mean, we're looking at science, right? They have the harshest lockdowns and restrictions in the country, and they're over 80% compliant. In fact, well over 80% compliant. It's almost like those masks and lockdowns don't do jack crap for corona. Not the beer, the virus. Oh, my gosh. Oh, my gosh. So we have overwhelmingly exceeded the mask compliance that was supposed to flatten the curve and reduce the transmission of the virus. So is it us? Or is it maybe that it's wrong? Maybe the so-called public health experts should shut the pie hole. Maybe they could learn something from listening to a few different opinions. No, you know what? People are always blessed. They're always blessed, and things always get better when you stifle and shut down, shove, shoot, or kill anyone who has a different opinion. That's how we got to the moon, guys. We had one guy in charge who said, this is the only way, and I'm going to kill everybody else. That's how we got to the moon. Yeah, I've read it in a brand new history book. For the overlords of control, there is no dissent. There is no choice. You do it. And if you don't, prepare to be dealt with. It's pretty amazing. You know, by the way, that's exactly what de Blasio said about the restaurant owner that is daring to defy him. He said, quote, there will be significant repercussions for this, end quote. Oh, jawohl. I don't mean to make you sound, it should be more like this. Yes, sounds very good. Maybe we put them into chamber downstairs and I break legs. A few weeks ago in Oregon, a nurse was put on administrative leave for admitting that she didn't wear a mask, not at work, but when she was off duty, she was fired. She made the statement on TikTok. Now she doesn't have a job. TikTok. Goes on and on. Guy working at a gas station in Indiana, fired for not wearing a mask. Professor at NYU now fighting for his career for making anti-mask statements during class. We got him in basement. Oh, he's going to meet Natusha in just a minute. You work at a casino in Vegas? Management already told their employees if you don't wear a mask, you'll be fired. By the way, the new one is if you don't get the vaccine, you're going to get fired. Oh, yeah, this is really great, coming from Silicon Valley. There's a new app that will show if you've complied. It'll be your digital passport to go places. Because if you don't have a digital passport that shows, yes, you've had the vaccine, you can't go anywhere. Water park manager in Wisconsin sent an email questioning the face mask policies. Questioning, he was fired. In Dallas, Texas, 2 election workers were fired for not wearing masks, even though Governor Abbott specifically made mask exemptions for poll workers. Restaurant owner in Florida, actually cited by, get this, code enforcement officers, yeah, and we like them, for not wearing a mask. They came back 2 days later, this time with police, found out he still wasn't wearing one. He was fired. But it's not even the actual act of not wearing a mask that will get you in trouble. Just a mere opinion This is so American. I just want to break out into la 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 la. This American national anthem, isn't it? Yeah. I just want to break out every time I see that somebody who has a different opinion is being finally silenced. Thank God. Or not God. We don't believe in God here anymore. Of course not. He's in the gulag. The Vancouver Canucks, their beloved anthem singer, was just recently fired for refusing to wear a mask while singing at a rally organized by anti-mask advocates. We've got to stop them. Yes, they're even leaking out and going in the middle of the night underneath our borders to places like Canada. It's a country. I'll tell you about it later. A member of the Public School Advisory Board in Boyertown, Pennsylvania, also recently fired for committing the cardinal sin of questioning masks. There will be no questions. There will be no toys. I could go further, but I think the message is pretty clear. You're not allowed to have a different opinion. We get it. You'll be destroyed for the mere thought that science isn't clear here, because it's science. When is science ever wrong? Well, maybe because I am a doctor. I don't know if you know this. Maybe it's the doctor coming out in me, but I'm old enough to remember that it used to be a good thing to question science. Actual scientists did it and encouraged other actual scientists to do it too. What was it called again? The scientific method. See, it was part of the process in those old, ancient, dusty times where you would question things and then you'd have to prove it. And new stats would come in, new evidence would come in, and if it didn't match up with your claims, the scientific method said, well, you should change your behavior. But now, they clutch their pearls every time someone questions the science of things like wearing masks or even, dare I say it, climate change. How dare me even say that? Because it's not like science has ever been proved wrong before, right? Remember when scientists used to say that the shape of someone's skull proved how intelligent you might be? Or we could tell by the shape of their skull if they're Jews or not. Yeah, bigots and racists never took advantage of science, did they? What about when the scientist of all scientists, Albert Einstein, said the universe was static and not expanding? Well, it's not. We should never question that. We wouldn't question Albert Einstein. How about in 1982? When Dr. William McBride claimed his research on a morning sickness drug proved that it caused birth defects. So the drug was taken off the market. Lots of lawsuits. Later found out he and his assistants, they all changed and altered the data to prove his claim. Yeah, found guilty of scientific fraud by medical tribunal. Jeez, I hope we shot him. They're questioning science. Yeah, damn right we're questioning science. In fact, question with boldness everything. Everything. Especially when the holy name of science is evoked to strip you of your rights, your livelihood, and God-given, constitutionally guaranteed freedom. Do not give in to being bludgeoned into submission. You're smart enough to make decisions regarding your own personal safety. We are masking up. Stop blaming us. Wear a mask, don't wear one. You know what's best for your situation. We don't need the government to impose these decisions on us. And any attempt to do so should be viewed for exactly what it actually is: fascism.